is next. So I just written everything in my book, so I will just dictate and go. So men's syndrome is going to be very important. That is men 1, men 2, men 3, that I have already explained to you previously also in medicine, also medicine, surgery, pathology, very important. Say men 1, where do you see? Men 2, where do you see? That is going to be very important. Then important is actually the infective endocarditis. See what happened with that picture you want to learn. That is what lesions, where do you see in rheumatic, how it is. That's all very important. See where certain like which condition this all those things will be in a straight thing or in the back to back. Where do you see in what happened in light man's sacks? That's all going to be very important. Okay, that's criteria is going to be very important. Then autoantibody section, that's myasthenia gravis, Joker's Crus syndrome, Hashimoto's, and all those things I have already explained. Very important. The tumor markers that you should learn. See how to remember all those tumor markers is that only solution is do MCQs. These all chapters just do the MCQs. Okay, very important. Without learning this, you cannot go to the exam hall. Is that markers, that is keratin pearls, because every time they'll be asking, like in squamous cell carcinoma, so they will give you an image and there'll be what is there, keratin pearls are there. So squamous cell carcinoma, and which all genes like P4T, P53 that you want to learn. Okay, that's very important. Then NAPS and A, TTF1, where it is, that is an adenocarcinoma. Chromogranin, synaptophysin, where do you see small cell carcinoma, colorectal and mesothelioma. That is going to be very important. Please don't go to exam hall without learning all those things. And also, yes, hemochromatosis I have already explained. Yes, and all those things you can do with the MCQ practice is very important. See, vasculitis is a very important chapter. That giant cell arteritis, that's all clinical condition you want to learn. That is vaginas, what happens, C ANCA, where you see C ANCA, where you see P ANCA, what happened in Kawasaki, all those genes, voila, please learn. Which is what is a pulseless, this is all time favorite. That is that Takayasu, voila. Then which artery, that's subclavian artery, very important. That's P Anka and C Anka is all-time favorite for the examiner's point. Then AML, CML, all I have already told. Then Hodgkin's lymphoma, where do you see that nodular and all eye appearance. Please learn that table, wala, very important. Then lymphoma, I already explained that. Starry sky, Burkitt's lymphoma, and all those things. Where do you see clover leaf type, that is helper T cell, wala. Where do you see Sézary syndrome? That's very important. Helper T cell. That's all those things. Parachute cell. CLL. Very important. Parachute cell. CD5 plus CD23 minus. Which drug you give? Fludarabine. It's very important. This is what I have already explained. Blood, never ever skip anything. Please learn in and out. As well as anemia point, I have told what happened in iron deficiency anemia. See what is increasing. Total iron binding capacity, that is a TIBC, is increasing there, as well as red blood cell distribution. That one table is there. Thalassemia, anemia of chronic disease, very important. Please learn that and go. And the next important thing is hypersensitivity. Voila, 1, 2, 3, 4, and where all condition, which all condition you see. These are hypersensitivity. SLE, where do you see, like in which type? Type 3, that is SLE, serum sickness, HSP, arthritis, PAN, PSG, and that is very important. So they will be giving this much and they will ask you, where do you see it? So that is going to be very important. Please don't skip it. And also the other important is CK7, CK20, while things. That is, they will be asking you like CK7 plus CK20 plus that markers, both positive, which all condition. And some other condition, 7 plus is there, but 20 is negative. Like that, 20 will not be expressed like that. There are certain conditions where CK20 is expressed but CK7 not, where it is, that is colorectal carcinoma, Merkel cell carcinoma. Please make some cards and learn all those things. Then very important is CA19-9, all time favorite, that pancreas colon, CA15-3, Where do you see breast carcinoma, that all those things. Please do MCQs and see S100, where do you see. Every time will be a question. INCT is also very, very important. Cytokeratin, where do you see? That is vimentin, where do you see? That box where are very, very important. Tumor markers, please learn and do with MCQs. It's the only solution. And where do you see that tennis racket of Birkbeck granules, LCH, very, very important. What happened, that's Hodgkin's lymphoma, what type of cells, RS cells, and what is that, CD15, CD30 positive, that is expressing that. Very important CD markers. Please don't go to exam hall without